Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine again. Today we're going to talk about febrile seizures, sometimes called seizures with fever. Remember that this educational series for parents is not intended to replace visits with your physician. If you have concerns, if you think your child has had a seizure, please contact your physician in the middle of the night, go to the emergency room. We, of course, would be happy to see you here in our office for consultation, area code 775-359-7111. So what is a febrile seizure, who gets them, and what do we need to know about this disorder? How common is it? Febrile seizures occur in about 1 out of 10 children. They are seizures that result from a fever. So the child, by definition, is sick with a fever. Many times, however, the fever onset is immediately before the seizure. So the first time you realize the child has a fever is when he or she is seizing. These seizures are typically tonic-clonic seizures. That's the medical definition, meaning they're the fall on the floor, shake around kind of seizure. The phrase a lot of people use to describe that is a grand mal seizure. So they're the grand mal type. They are typically short seizures lasting less than 5 minutes. They typically occur between 6 months and 5 years of age. If the child is less than 6 months of age, this is most likely not a febrile seizure and needs to be thoroughly evaluated. If the child is over 5 years of age, this could be any of a number of other things, but is not a typical febrile seizure, needs to be thoroughly evaluated. When these happen, what do you do? Well, if the fever lasts for more than, or if the seizure lasts for more than 5 minutes, you do need to call 911. Medication will need to be given to terminate that seizure. If the seizure lasts for less than 5 minutes, then the child needs to be evaluated urgently, but not necessarily by way of 911. What do I mean? Call your doctor right away during the day. Nighttime, bring him into the emergency room. He or she needs to be looked at that night. Between 6 months and somewhere between 12 and 24 months of age, when a child has a febrile seizure, the risk of this being something other than a typical febrile seizure is still a little bit high. For that reason, many authors, myself included, suggest that these children need to be evaluated with a lumbar puncture, or sometimes called spinal tap. This will help rule out meningitis and is the only way to rule out meningitis, considering the risks of meningitis, which include death and serious brain damage, versus the risk of a lumbar puncture, which is very little risk whatsoever. It's well worth doing. Once the child's over 2 years of age, and the reality is most febrile seizures are between 2 and 4 years of age, the child does not need a lumbar puncture unless there was something unusual with the seizure. Typical seizures involve falling on the floor, eyes rolling back, foaming at the mouth, turning blue, stiffening in the joints. Once the child has had the seizure, they are typically confused afterwards, and that may last for upwards of 30 minutes. As long as the confusion improves within 30 minutes, there's no need necessarily for additional testing, assuming the child has a fever to go with everything. At that point in time, the most important thing to do is to look for a source of the fever. The most common source, realistically, if there's going to be a single focus, is an ear infection. Many times it's a viral syndrome with no specific focus, but if there is a focus, it's an ear infection. So careful attention needs to be paid to the ears. We can do something about this, and we should treat it. 1 out of 10 children get febrile seizures. So this is a very common event. Of those who get one, about 1 out of 3 have a second one. Of those who have 2, half have 3 or more. So again, these are very common. Does the child need to see a neurologist? Not necessarily. If it's a typical febrile seizure lasting less than 5 minutes between 6 months and 5 years of age, the child had confusion after the seizure that lasted for less than 30 minutes, and there were no other issues, then the child probably does not need to be on any seizure medication, nor does the child need to be seen by a neurologist. If the child has recurrent febrile seizures, if they are prolonged, if the child is outside of the normal range, if they are what is known as focal, meaning the seizure starts in a foot or a toe, or the lips, and then spreads to the rest of the body, then the child needs to be thoroughly evaluated with an MRI and most likely follow up with a neurologist. If the seizures keep happening, many times we will prescribe some medicines to help either prevent or terminate the seizures for the parents. But again, this is very common, and although it's a very scary event, and it is something that needs to be evaluated quickly, it's not necessarily something that you need to be particularly concerned about for the long-term health of your child. This is not epilepsy. These children grow up to be normal. This is Dr. Kevin M. Windisch, Sparks Pediatric and Adolescent Medicine. If you need a consultation, if you're concerned that your child has febrile seizures or concerned that your child's seizures are not febrile seizures, give us a call, 775-359-7111.